Right, so good afternoon, everyone. Thank you for joining the webinar this afternoon, which is on our Zurich Rehabilitation team. My name's Heidi Buckingham. I'm a sales and distribution consultant here at Zurich, and I'm joined this afternoon by Jenny Bond and Joanne Carter, who both work in the Zurich Rehabilitation team. A bit of housekeeping before we kick off. Everyone's in listen-only mode at the moment, but if you have any questions during the webinar, feel free to just put them in the chat box and we'll answer those at the end. Once the presentation's finished and we open it up for questions, I'll take it so you can come off mute and on camera if you did want to ask any questions then, or alternatively you can still ask them over the chat. The webinar is being recorded this afternoon, and I'll send out a copy of the recording and a copy of the slides that we go through afterwards, as well as a feedback survey, which would be really grateful if you could fill in, especially about any topics you'd like to hear from for future webinars. And with that, I believe I am handing over to Jenny.
Heidi. Hi everyone, thanks for joining today and thanks for listening to us talk about the rehab team. I have some slides to go through, so I'm just going to add those. Bear with me. Start those. Okay, so Zurich Rehab team. So you may have come across us previously in the past. I'm not sure if anyone has interacted with us before or not, but we were previously known as the Medical Management Centre, or MMC for short. We were rebranded probably about a year ago now to the Zurich Rehab team, or ZRT for short. So that's a bit of an update there if you have heard of us in the past. We are ZRT now. And who are we then? So we are a team of 9 from varying clinical backgrounds. So I think we have 5 nurses on the team now. So 5 from nursing backgrounds, myself and another person are sports therapists, and we have someone from a psychological background as well. And we're all individually vetted by our own governing bodies, so we have to maintain a certain standard of quality in order to provide treatment legally by those governing bodies. So what we do is provide rehab for any employee who sustains a work-related injury at work, and we are part and parcel of the insurance policy. So that's in a pre-claim situation, and that's where the customer can refer directly to us, and we liaise with the injured employee and the customer, and we arrange treatment that way. And in a post-claim, so where the injured employee has raised a claim, we operate under the Rehab Code 2015. So what we do then, if I draw your attention to the blue square on the left, there's a couple of statistics there from the HSE. Those are 27,000 people leave work for good each year because of a workplace injury, and 38.8 million working days are lost each year at a cost to the UK of 16.2 billion. So essentially what that means in a nutshell is absence from the workplace is expensive. So the customer will obviously have to pay for a sick pay and to cover that injured employee with alternate members of staff, and obviously the longer they are off, the longer they have to cover those sickness pay costs, obviously up to a certain amount, and cover that person with alternate members of staff. So the longer they're off, the more expensive it becomes. And there is a statistic there at the bottom which says pre-claim intervention, so utilising us as early on as possible once the injury has occurred, can result in up to a 25% net savings on claims cost in comparison to non-rehab cases. So that's where we're not utilised, and then potentially that person makes a claim. Obviously those costs add up as well. So our approach is that we work proactively. So what we mean by that is we like to act quickly, and we collaborate in team and outside of the team. So we collaborate with each other in the team. So for example, if someone in the team has a little bit more expertise in a certain area, then we'll look to feed off that person's knowledge and just make sure we're all providing the best rehab and care that injured employee needs as much as possible. So for example, one of my one of my colleagues has a bit more expertise in head injuries. So if there's a head injury, we'll look to ask her for advice, or perhaps send the referral her way instead. And the colleague from a psychological background, if there's a psychological issue which is a little bit a little bit confusing, just ask for her help as well, just so we all ensure that the injured employee is getting the best care possible. And we also work collaboratively within Zurich as well. So if we, for example, notice the same pattern of injury coming from the same mechanism of injury, we can utilise our risk management department and perhaps send them out to do an assessment to ensure that no further injuries occur um, from that mechanism of injury again. We can also utilise other parts of Zurich. So, for example, fraud, if something is looking a bit suspicious. So we would look to proactively collaborate within Zurich as much as possible. So the benefits for using us, then there are quite a few, but the main one is that it improves relations with employees. So if you were to put yourself in the position of an injured employee, you may not have had an injured before. Sorry, you may not have had an injury before, so you naturally have a lot of questions around that. So you may be thinking, how long am I going to be off work for? Is this going to impact me financially? How long is sick pay going to last? Am I going to be able to take my kids to school? Am I going to be able to get back to my hobbies? And that can all have a big impact on that injured person, and it could result in some mental health problems as a result. And there's a lot of pressure really around an injury, and there might be some pressure from work as well to get them back to work as soon as possible, and that injured person might not have the answers. So utilizing us as early on as possible gives that person some support from well early on in the injury. We answer some questions that they may have, and we can obviously arrange treatment sometimes more quickly than the NHS. So we could look to get that support in as early as possible. So you may find that reduces the risk of that person raising a claim quite early on. And because of that, we also reduce the cost of the injury. So, for example, if that person's waiting for physiotherapy in the NHS, which could take about 6 months, we can look to get that arranged within maybe a week or two and get treatment started much quicker and much earlier on. So potentially they could be back at work within a couple of months' time, maybe on reduced duties to start with, but they could go back to their full duties a bit more quickly than they would if we weren't involved. So the cost of that person being off is reduced. And obviously, if they don't raise a claim as a result, then that cost is missed out completely as well. And there's access to our medical expertise as well, and that's just not just for the injured employee but for the customer. So if they have a question about an injury, then we can provide our opinion and just our medical advice on how to help that person get back to work as quickly and as efficiently as possible to avoid future injuries. So we updated our proposition again about a year ago now. There's a couple of changes there which is important for us to go through. So it's good for us to just readdress this just in case you have experienced us in the past and there's any confusion there. So our updated proposition is to treat acute symptoms, and these can be new or exacerbated, arising from a work-related incident which is affecting the injured employee's capacity to work. So firstly, what we mean by a work-related incident is if the injured employee played football on a weekend and sprained their ankle and then tried to come back to work and unfortunately had to have some time off work, that wouldn't count as a work-related incident, so we wouldn't be able to provide treatment for that. And by affecting their capacity to work, there is a misconception that they had to have had lots of time off work, but that's not true. They may just be on reduced duties or reduced hours, or they may have just had the afternoon or a day off and gone back to work, but it just needs to be affecting their capacity to do their normal job, their normal duties. And by acute symptoms, what we mean is as early on as possible. So ideally within that 6 months. So this is in a pre-claim situation. We ask that they are referred to us within 6 months, but as early as possible. And that's because the earlier rehab can become involved, the more likely it is that that rehab will have a good outcome and there's not going to be any reoccurring issues in the future. And anything longer than 18 months becomes chronic, and that just means that rehab is likely to be a bit more invasive. It's more likely to be surgical intervention rather than non-invasive physiotherapy. So yeah, ideally the earlier on the better, and that's what we mean by acute. And by exacerbated symptoms, it's not something we used to do, but what we mean here is if someone has, for example, a history of low back pain, and they manage this normally by themselves, and they may pick a heavy item up, and this causes an exacerbation of their pre-existing back pain. So in this situation, we would accept the referral. We may just provide a short course of treatment to get them back to be able to do their current role, but for anything more long-term solution or maintenance, we'd look to refer back to the NHS. And this is because the NHS have the resources to be able to provide the long-term and maintenance treatment management, whereas we don't, unfortunately. We look to treat the acute short-term symptoms. So hopefully that clarifies a few things there. So a couple of new trends that we have going on at the moment is particularly psychological treatment. So over the last couple of years, particularly since the start of COVID, we've noticed an increase in psychological referrals, and it's not always a secondary injury to the first one. It may be that someone's just having the psychological issues or work-related stress, and we can provide treatment for those as well. So again, if you go back to putting yourself in the shoes of a person, an injured person, as I mentioned, it may have an impact on your mental well-being, and we are finding that is increasing a lot. So there can be symptoms such as anxiety, depression, and PTSD, which is post-traumatic stress disorder, depending on the severity of the injury. So what we would do is refer to our treatment providers for a virtual, so remote, it's usually over Microsoft Teams, for a remote psychological assessment, and then for remote treatment as well. So normally we'd have an idea of what kind of treatment we want them to have. So we'd either refer for CBT, which is cognitive behavioural therapy, which is a little bit lighter. It's more focused on changing behaviour patterns, or we would refer to EMDR, which is eye movement desensitization and reprocessing. Just glad I got all that out in one go, which is a bit more of a trauma focused, bit of a heavier therapy. If we're not, usually we have an idea on referral, but if we're not sure, we'd just leave it to the expert to determine what kind of treatment they'd have and wait for the initial report to come through. But we work with our treatment providers to make sure that injured party is having the most appropriate treatment possible for the symptoms that they have. And work-related stress is now part of our proposition, which wasn't before. It is still a little bit of a grey area. It may involve a conversation with the customer around the referral, but just to ensure that it is related to work, and then we can look to provide a short course of treatment for that as well. And just on the note of our psychological treatment, we have recently been nominated for an award at the Insurance Post Claims and Fraud Awards 2022. The results won't be announced until the end of the year, but hopefully that will be something to add there to our belt. But I think it's good just to mention that we are doing quite well with our psychological provision at the moment. And what else is new? So another trend that I'm sure everyone has heard about is that the NHS is understaffed, and the NHS are subject to a lot of long delays at the moment. And I'm sure if you have been trying to arrange a GP appointment or any other appointments, you are very aware of this at the moment. But yes, I'm sure you've heard of this on the news recently. I'm not going to go into those statistics too much because they are from February of this year. So I think the situation has changed slightly. In fact, I actually think it's worse than those statistics on there. So what we're finding in certain areas or certain treatment provision, the delays are quite long. So particularly physiotherapy and mental health services. Physiotherapy is, sometimes it's about 6 months for treatment to start, and sometimes it's by phone as well, which isn't always appropriate, but that's all the NHS are able to offer due to the delays. And mental health services, I think in the NHS, are up to 18 months waiting list. So it's just, unfortunately, it's not sustainable. So we are able to provide, we're able to refer for private treatment, which is arranged a lot more quickly. And the unfortunate thing is, because people are waiting for a long time in the NHS, people are looking to seek private treatment a little bit more. So we are noticing a bit of a knock-on effect on the private sector, and they are starting to become a little bit more delayed. We are able to provide treatment a lot more quickly by expediting privately, but compared to the NHS, sometimes it's months and months and months, but there is a little bit of a delay, whereas pre-COVID there wasn't that delay. So unfortunately, there is a bit of a knock-on effect. So a couple of new things to go through, newish things to go through. So it's probably worth mentioning Zurich support services. So sometimes we get referrals where it's not necessary for us to refer that person for any treatment through our treatment providers. It may be that their injury is resolving and they're happy to just continue with what they're doing, or um, they're having the treatment through the NHS, which is already appropriate, so we'll leave them within that service. But they may have some questions around legal support, financial services, or work concerns. So what we can do is we have some support services, which is a list of some helplines and guidance, and we can provide that to the injured person, just to give them that information, really. And sometimes that can prevent them from reaching out to a solicitor and getting that legal advice and perhaps putting a claim in. So this basically makes us a more of an all-round service for injured parties. So we're not just giving them rehab and letting them get on and find guidance from elsewhere. We're looking to provide that whole treatment for them, give them advice where possible. The support services also covers a very limited amount of counselling. So if they have some impact to their anxiety, or some symptoms of depression, but it doesn't really warrant a referral to our treatment providers, which can be quite expensive. We can look to provide them with a very limited short course of counselling through the Zurich support services. So it just kind of gives us that all-round approach to providing rehab, and we're not just focusing on the injury and then not even thinking about anything else. Another new thing, which is quite recent as well, is that we have our own video calling software. And this probably sounds quite trivial and not that exciting, but it actually is, because Zurich have developed this software. And when it was in the development stages, I worked quite closely with the development team, because they were keen for us to get it started with us, with our team initially. They recognised that there was a good opportunity for us to start that using that first. And although it sounds simple because we're so used to using Microsoft Teams, but not everyone has a video calling software available. So what that allows us to do is actually see the patient. We can assess them visually, rather than relying on a subjective description from someone who doesn't really know medical terms, or they may not be giving us enough information. We can actually see them in person. So instead of asking someone, for example, to describe a shoulder injury, we can just say to them, point to where it hurts, and they can just say, here. And that just makes things a lot more easy for us, so I know exactly what they mean and where it is. So it's made a big difference, but it also allows us to provide that better support to them. So it puts a face to a name. It's just better for mental health to be able to see that person who's supporting you, to be able to see that person who's talking to you. So that's made a really big difference for our team and for our assessments, and it just allows us to be a bit more specific and a bit more accurate with our referrals as well. Not that we weren't accurate before. And we have a couple of new QR codes as well that we'll send out. One of them takes us to our external web page, and the other one is for a referrals portal. This is for customers to refer to us. It's a lot more streamlined, it's a lot more efficient, so it will come straight to us through that referrals portal. And this is in all of the teams' email signatures as well, so we have that available to be scanned at any time. I just want to quickly show you the external website. I just have to stop my presentation, bear with me. So our external website can be shared with customers. It has a referral guide, our rehab guide, which explains everything that I've just discussed, but in a bit more of a condensed brochure, so it's easier to follow. And we have a referral form as well, some guide to referrals, and we have our plethora of rehab guides available. So these can be provided to the injured employee, but also to the customer as well. And it just gives a lot of information around different types of injuries and answers some questions. We also have a frequently asked questions page. So it has a lot of information that can be presented to the customer externally. But that is everything I have to go through. So I'll stop sharing my screen and pass back to Heidi, and I'm happy to answer any questions anyone may have.
Thank you, Jenny. We've got a couple of questions in the chat box so far. So first one from Elaine, who said, would this be suitable to someone who caught COVID at work and now suffers from long COVID?
I think we did have a discussion about long COVID before, but we never actually followed through with that. I think if we would have to have a discussion, I think, to see how it's impacting their work, and perhaps we can look to arrange something short term for them, depending on what their symptoms are.
Thank you. Another question from Julie, who said, is ZRT available to an employee regardless of who is at fault for the injury?
Yes. Yeah, we are liability. So in a pre-claim referral, liability is not it's not even considered at that point. When it's becomes a claim, then it's something that needs to be factored in. But in a pre-claim, liability is not an issue.
Thank you. Any other questions? Just feel free to pop those in the chat box.
Yes, it's kept confidential. Yeah, we only share, for example, a medical report that would be shared with the injured party. We wouldn't share anything with the customer.
Thank
Unless
you.
they asked us to. If they asked us to and they gave written permission, then we would, but it's not something we do.
I've just updated the settings, so if anyone does want to ask anything off mute, you now can, or alternatively, any other questions in the chat box. Got another one in there from Neil about face-to-face consultations and whether they can be arranged.
Would you mean a face-to-face consultation with us, or do you mean with the treatment provider? If it's us, then no, unfortunately, we're a remote team.
Anthony Pye, I'd like a word as well. Okay.
Treatment provider. So physiotherapy, yes, we look to refer them for face-to-face as much as possible. Consultants, yes. Sometimes the consultant may only have availability to do a phone call. It depends on their availability and how busy they are. For psychological treatment, it's usually remote, and this is just because of demand on mental health services. We can look to arrange face-to-face. Normally, it takes a little while longer just because of availability. So if we can find a clinic that has availability through our treatment providers, then yes. But if there's no face-to-face clinics with availability, then we'll look to do it remotely. But it's very quick, remote, and it does have a really good positive impact as well. So we've noticed that it's just as good as face-to-face therapy.
Thanks, Jenny. Another question, how does this service interface with our occupational health provider in case management?
It depends on who the referral comes from in the customer. So some customers will ask the occupational health department to liaise directly with us. They'll send the referrals in, we'll update them. Some customers prefer HR to do the referrals and to manage the cases that are having rehab, and then they'll liaise with occupational health. What we do is try to interact with occupational health where possible, because they're the ones that are going to essentially have the last say of them coming back to work. So where possible, we'll try to interact with them, as much as possible. But it depends on the customer and what they want and how they want to operate. We ask for one person typically to do all the referrals to us, and in turn we'll offer a case manager assigned to that customer to liaise with them directly. But it does depend on how the customer wants to operate.
Thank you. Right, no other questions in there at the moment, so I will wait for another minute or two in case anyone does have any more questions that they'd like to ask.
I'll take it as a good sign that there's no questions to ask.
Yeah, obviously answered everything. Well, I will send around a copy of the recording, as well as you'll be able to access the link to the external website that Jenny shared as well, if you wanted to share that with any of your customers. And I'm sure if you do have any questions, Jenny or one of the other people in the team would be more than happy to answer those for you. But it looks like we're not getting any more questions in, so we can close the webinar here. As I said, it would be really grateful if you could fill in the feedback form that I send round. But thank you very much to everyone for joining this afternoon, and thanks to Jenny and Joe as well. And hopefully it's been a useful session to learn a bit more about our rehabilitation team, which I believe is quite a USP for Zurich, and not something that's particularly offered to this degree by many of our competitors. So hopefully it's been an interesting and informative session. But I hope everyone has a good rest of the afternoon and rest of the week, and hopefully see you at another one of our webinars soon.
Thank you, ladies. Much
Thank
appreciated.
you.
Cheers.
Thank
No
you.
problem.
Thank you.
Thank you.
Thanks.
Thank you.
Bye.
Thanks very
Bye.
much. Cheers.
Bye.
Thanks.
Bye.
Bye.
Thanks. Thanks. Bye.